Have you ever wondered how a single drug can treat irregular heart rhythms? Welcome to the intriguing world of amiodarone pharmacology, an arena where science and medicine intertwine to combat cardiac disorders. In today's video, we're going to peel back the layers of complexity surrounding amiodarone, a medication that has long been used in the treatment of life-threatening heart rhythm problems. This journey will take us through the various aspects of amiodarone's pharmacology, from its astounding mechanism of action to its fascinating pharmacokinetics. We'll also delve into the potential side effects and drug interactions, providing a comprehensive understanding of this versatile medication. But don't worry, we'll break down these complex concepts into easy-to-understand segments. Whether you're a seasoned medical professional or just a curious mind, this video is designed to enlighten and inform in a digestible manner. So buckle up and prepare for an exploration like no other. Join us on this journey as we unravel the mysteries of amiodarone. Before we delve into the deep, let's understand what amiodarone is. Amiodarone, a name that might sound like a character from a science fiction novel, is actually a potent and widely used drug in the world of medicine. Specifically, it's an antiarrhythmic medication, which means it's used to treat and prevent certain types of abnormal heart rhythms or arrhythmias. Now, you might be wondering, what's so special about amiodarone? Well, it's not just your run-of-the-mill heart medication. It's one of the most effective antiarrhythmic drugs out there. To give you a bit of perspective, arrhythmias can range from being harmless to life-threatening. They occur when the electrical impulses that coordinate your heartbeats don't work properly, causing your heart to beat too fast, too slow, or irregularly. And amiodarone steps in to save the day by helping to restore normal heart rhythm. But it doesn't stop there. Amiodarone is also unique because it's a broad-spectrum antiarrhythmic drug. This means it works in several different ways to control heart rhythm, which makes it useful in treating a wide range of arrhythmias. From ventricular tachycardia, which is a rapid heartbeat that starts in the heart's lower chambers, to atrial fibrillation, a quivering or irregular heartbeat that can lead to serious heart-related complications. In the grand scheme of things, amiodarone plays a significant role in maintaining the rhythm of life, literally. It's like the conductor of an orchestra, ensuring each section of the heart plays in perfect harmony. Its ability to treat a variety of arrhythmias has made it an invaluable tool in the medical field. However, it's not a drug that's used lightly. Amiodarone is usually reserved for severe arrhythmias that haven't responded to other treatments, or when other treatments can't be used. This is due to its potential for serious side effects, which we'll discuss later in this video. Now that we know what amiodarone is, let's explore its mechanism of action. Amiodarane's mechanism of action is like a well-choreographed dance. Let's dive into this dance and see how amiodarone interacts with the heart's electrical system to help restore a normal rhythm. Amiodarone is a potent antiarrhythmic agent, but what does that really mean? Well, it means that it's a drug with the ability to suppress abnormal rhythms of the heart, such as atrial fibrillation and ventricular tachycardia. It's like a conductor stepping in when the orchestra starts to play out of sync, bringing back harmony and rhythm. So, how does amiodarone do this? The magic lies in its ability to affect the electrical signals that control the rhythm of your heart. It's a Class 3 antiarrhythmic drug, meaning that it primarily works by blocking the potassium channels in the heart cells. This action prolongs the phase 3 of the cardiac action potential, which is the repolarization phase. In simpler terms, it gives your heart more time to fill with blood before it contracts to pump blood to the rest of your body. But amiodarone isn't a one-trick pony. It has a broad spectrum of activity and also possesses characteristics of all 4 Vaughan Williams antiarrhythmic classes. This means it can also block sodium channels and non-competitively block alpha and beta adrenergic receptors. These actions slow down the electrical impulses passing through the heart, reduce the force of contraction, and decrease the heart rate. Now think of these mechanisms like the steps in a dance. Each movement, each step has a specific role in maintaining the overall rhythm. In this case, the rhythm of your heartbeat. But, like in any dance, timing is crucial. Amiodarane's effects are not immediate. It may take a few days or even weeks for it to fully control the heart rhythm, so patience is key when starting this medication. And there you have it, the intricate dance of amiodarane's mechanism of action. It's a complex interplay of blocking channels and receptors, all working together to restore the rhythm and harmony of your heart. So we've seen how amiodarone works, but what about its pharmacokinetics? Pharmacokinetics, while a mouthful to say, is crucial in understanding any drug, including amiodarone. Let's start with absorption. Amiodarone is taken orally and is absorbed slowly from the gastrointestinal tract. However, its absorption is somewhat unpredictable due to its highly lipophilic nature. This means it's attracted to and dissolves in fats, oils, and lipids. Because of this, the bioavailability of amiodarone can range widely, from 22 to 86%. It's worth noting that food can increase the absorption of amiodarone, particularly fatty meals. Now let's move on to distribution. Once absorbed, amiodarone is widely distributed throughout the body. It has a particularly high affinity for adipose tissue and highly perfused organs, such as the liver, lungs, and spleen. It's also extensively bound to plasma proteins, with over 96% of the drug being protein-bound. Next up, metabolism. Amiodarone is primarily metabolized in the liver by cytochrome P450 enzymes. The main metabolite is desethylamiodarone, which is also active and contributes to the drug's effects. The half-life of amiodarone is quite long, averaging around 58 days. This means it can take a considerable amount of time for the drug to be cleared from the body. Lastly, let's discuss excretion. Amiodarone and its metabolites are excreted mainly through the bile and into the feces. Only a small amount of the drug is excreted in the urine. This is important to remember, especially when considering drug interactions and potential side effects. To sum up, amiodorone's pharmacokinetic profile is characterized by slow, variable absorption, widespread distribution, extensive protein binding, metabolism in the liver, and excretion mainly via the feces. It's a drug that requires careful monitoring due to its long half-life and potential for interactions. With the pharmacokinetics clear, let's move to the potential side effects of amiodarone. While amiodarone is a lifesaver for many, it's not without its side effects. As with any medication, amiodarone can cause a range of side effects, some more common than others, and a few that are quite severe. Let's start with the common side effects. Many patients may experience nausea, vomiting, or a loss of appetite. These are often temporary and may subside as your body adjusts to the medication. However, if they persist, it's crucial to seek medical advice. Some people may also experience constipation, or on the flip side, diarrhea. Skin reactions like photosensitivity and blue-gray discoloration can also occur, so it's advised to protect your skin from the sun while taking this drug. Now let's delve into the more severe side effects. Amiodarone can affect multiple organs, particularly the lungs, liver, and thyroid. Pulmonary toxicity, manifesting as a chronic cough or shortness of breath, is a serious concern and requires immediate medical attention. Liver damage is another severe side effect, so regular liver function tests are recommended. Lastly, both hypo and hyperthyroidism can occur due to amiodorone's high iodine content, making regular thyroid function tests a must while on this medication. Another crucial aspect to keep in mind is amiodarone's effect on the eyes. Some patients may experience visual disturbances, and in rare cases, optic neuropathy, a potentially sight-threatening condition. The occurrence of these side effects underscores the importance of regular monitoring. It's essential to have routine checkups and blood tests to ensure that any potential adverse effects are caught early and managed effectively. Just as a coin has two sides, so does amiodarone. On one hand, it's a potent antiarrhythmic drug that can significantly improve quality of life for those with heart rhythm disorders. On the other hand, its side effects can be quite serious and need careful attention. Side effects are important to consider, but so are the drug interactions. So stay tuned as we delve into the fascinating world of amiodarone's interactions with other medications in our next scene. Like in a symphony, harmony is key, and that applies to drug interactions as well. Now, let's delve into the dance of amiodarone with other drugs in the system. Amiodarone, being a potent medication, has a long list of potential interactions. One of the most significant interactions is with drugs that prolong the QT interval. When combined with amiodarone, these can potentially lead to a life-threatening condition called torsades de pointe. Warfarin, a commonly used anticoagulant, is another drug that requires careful attention. When administered concurrently with amiodarone, the anticoagulant effect can be amplified, leading to an increased risk of bleeding. Simvastatin, a cholesterol-lowering drug, can also interact with amiodarone, leading to an increased risk of muscle toxicity. Likewise, amiodarone can increase levels of digoxin, a heart medication, potentially causing digoxin toxicity. Understanding these interactions helps ensure safe and effective treatment with amiodarone. Knowledge is power, and in this case, it could be a lifesaver.
Don't forget subscribing. Thank you.